when we're working with the elbow, medial epicondylitis, lateral epicondylitis, then we're going to want to needle the healthy side so that they can move the affected side. And we want them to move through the full range of motions that are possible with the elbow joint. Now, in the balance method and in the master tone system, you've probably learned that you can use the points at the knee to treat the elbow because the elbows and knees, they mirror each other. And while I like the treatment of using the combination of Ling Gu or Li4 with Li11 to treat the opposite knee, that I find to be very effective, I don't tend to see that the knee is able to alleviate the pain in the elbow so powerfully. Okay, so when I'm working with the elbow as a primary complaint, I may and probably will do some points around the knee, but I think of those as more secondary or supplemental. What I find works best is rather than needling the knee for the elbow, it's very effective to needle this opposite elbow. So if she has left elbow pain, medial epicondylitis, or lateral epicondylitis, I want to needle the points on the healthy side where she feels the pain, okay? And if she feels pain over into like lung 5 on the affected side, then I would needle lung 5 on the healthy side. If she feels it at Li11 and Li10, I would needle those 2 points on the healthy side and then have her do the movements. Now, I may still do the knee points, but I think of those as secondary or supplemental, and I want to be aware of what points I choose on the legs so that I'm able to address not only their primary concern, but also their second and third concern. What I want to demonstrate now is what movements will have the patient do. So I'll put the needles in first. Let's say that we're working with lateral epicondylitis or tennis elbow, and they feel it mostly at Li11 and perhaps even down into the Sanjiao line. I'll needle Li11. I do like to add Li10 a lot of times, or points like 33.08 and 33.09, which are closer to the Sanjiao and small intestine meridians. They're over there closer to the ulna. So after I do the most appropriate points based on where she feels the pain and mirroring the needles into the healthy side, then I'm going to have her do these movements. So the first one is just flexion and extension. So go ahead and bend your elbow. Yeah, just do 10 of those. And as you do this, you want to watch and observe how they're moving and get feedback from them. You know, they may report that they feel pain during a certain part of the motion. Maybe they feel it more with the flexion. Maybe they can't go into full extension. She can, but sometimes people can't fully extend. So you have them do those movements. And then the next movement is rotations. And one thing I observe with a lot of people when they first start doing this, they may not have like a full circular rotation. So you want to make sure that they get like a full range of motion through that whole circle. And then after they do 10, have them reverse and go the opposite way. So we've done flexion, extension, and now rotations. And then to that, we also want to add pronation and supination. So, yep, have her. Now she's using her shoulder more when she picks it up. So go ahead and relax your shoulder and then just move your hand. So yeah, rotate your hand. And check in with them, make sure that they're not feeling pain anywhere. Ask them if they're feeling pain, any part of the movement. If they are, then use that information to refine your treatment strategy. So those are the basic movements: flexion, extension, rotations, and then pronation, supination. Have them do those 3 exercises with 10 repetitions each.